Annual Death Statistics Report 2025-26, Rachel Watson, IOPC Director General. Why is the Annual Death Statistics Report an important piece of work of the IOPC?
It is, indeed. It's our statutory duty to produce this every year, and every police force has to report to us every death following police contact or during police contact. It's really important for the public that there's transparency about what happened and why, but also there's an opportunity for learning. When we investigate, we issue recommendations that can help ensure where death is preventable, that things are done differently so that doesn't happen again.
It's a statistical document, but we shouldn't forget that there is a life lost and grief behind every entry in this report.
Absolutely. It's more than statistics. Every single death is a human tragedy, and loved ones, families are left behind, and they absolutely want answers, and it's right that they get these answers, and it's right also that policing learns where it can and that improvements are made to keep everyone safer.
How can this report and the IOPC more widely help policing improve?
The IOPC issues learning recommendations. We issued over 60 last year, and over 20 of those related to deaths during or following police contact. And they can help police forces make improvements, for example, to training, to call handling, to the equipment that's issued. And those improvements can help potentially prevent future deaths and save lives.
There has been an increase in the number of people who've died in police custody. Is that a concern?
Every loss of life is of course a concern, and they leave behind families, loved ones, and it's important that these are investigated very carefully. The IOPC investigates every death in custody so that families get the answers that they need. It's important to say though that these are very small numbers, and that's in the context of over 900,000 arrests. So these are small numbers, but that doesn't mean they're not important, because behind everyone is an individual tragedy. And where we can learn lessons, where improvements can be made to prevent recurrence, that's very important, and that's what we need to do.
How is the IOPC's work contributing towards reducing the number of deaths in custody?
The IOPC has a role in investigating every death in custody and making recommendations where things could have been done better. Our learning recommendations are very important there. Of course, we issued more than 20 last year, and these will have lessons in them potentially around training, around the equipment use, around call handling, and these can help prevent future deaths. We also support inquests as well, which again are important sources of lessons here. We're working with the National Police Chiefs Council and the Independent Advisory Panel for the Prevention of Deaths in Custody on preventing people potentially self-harming after leaving custody. And we're looking at recommendations there, including around how they can be best safeguarded.
The report again shows many deaths following police contact involve drugs, alcohol, or mental health. It seems to be a recurring theme.
Sadly, mental health, drug and alcohol abuse are recurring factors in deaths in and following police contact. That emphasises the importance of ensuring proper training for policing so that police officers recognise the signs, and also the importance of the provision of other services as well. This, of course, is not just a problem facing policing, but it's important that the NHS as well and mental support services are also in place. Police custody cell isn't the right place for someone having a mental health crisis or who is extremely unwell. So it is important that policing are able to access other services to ensure that people get the right care from the right people.
Visit our website to read our Annual Death Statistics Report 2025-26.